This video discusses a central dressing line change, which is what you do for a PICC or midline. Sometimes people will feel like a midline is not a true central line, but the care and maintenance is going to be the same as a PICC line. So the first thing that you're going to do is review your order and make sure you use your patient's 2 identifiers, which would be name and birthday. Room number is not acceptable. So that would be one of the first things you'd want to do. You'd also want to explain the procedure to your patient and make sure that they're in a comfortable position. Most facilities prefer you to ask family members to wait outside the room, or they can wear a mask if necessary for a dressing change. So let's get started. All right, before I do anything, I'm going to perform hand hygiene. So you would clean your hands and put on gloves. Make sure your work area is nice and clean. Explain it to your patient and position them in a correct position. Usually it's good to raise the bed up so you're comfortable and put their arm out. So with their arm out, I've cleaned my hands and I've got on clean gloves. I'm going to take a look at this site. If I notice any redness, swelling, any drainage, I'm going to make a note of that. I'm also going to make a note of how far the external catheter is at this point, because we want it at the same point as when we started. If it starts to come out, that could be a problem and you'd need to get an x-ray. Of course, if it does start to come out, you would never push a line back in. That's huge risk of infection, and also you don't know where your line is going to end up, so never do that. All right, everything is set up. Before I do anything, I'm going to put on my mask. Sometimes we'll see where people are already taking the dressing off without wearing a mask. At that point, you've already breathed all over your site, so always wear a mask before doing that. Have the patient turn their head or provide a mask for them. Okay, so I'm going to open my sterile package. And I'm going to put on my mask. Now, your facility might use a CHG Tegaderm, or they might use a Tegaderm and a bio patch. It's good to be familiar with both, because if they're admitted from a different facility, it might be something you're a little unaccustomed to. So just kind of get familiar with both. So another thing that I'm looking at while I'm doing this is I'm making sure that the dressing itself was properly adhered before I touched anything, because I would want to make a note of that. So it's good to start on these outer edges and just kind of pull this way. Once we actually start removing the dressing near the insertion site, there is a very particular way to pull, because at Midsouth PICC, we do not suture our lines in. Evidence-based research has shown that that's an increased risk of infection, so we do not suture any of our lines. So that being said, you can accidentally pull a line out. So this little tip will help out. Always pull towards your insertion site. Never pull down, because you can pull the line out. And that just comes right off. If you have trouble getting the Tegaderm off, you can use some alcohol around it, and that will loosen up the CHG gel as well. Now, the next step you've got is your securement device. You might see a stat lock, which has the plastic clips, or you might see a grip lock, which is what we've been using more and more often. It's just Velcro and sticky. So, being careful not to touch the insertion site, I'm going to remove my stat lock. Okay. So the old dressing is now off. One step that we see that's forgotten pretty often is that you need to perform hand hygiene between taking the old dressing off and putting on sterile gloves. So please make sure to do that. So I'm going to demonstrate using a CHG Tegaderm dressing. I'll also show you how to properly apply a bio patch in another video. With my sterile gloves on, I'm going to start the cleaning process. I'm also going to be careful to note again where the external measurement is on my line. Of course, if it starts to pull out, like I said, we would never push it back in. That's something you need to be very cautious of. The first step is going to be to clean with the alcohol swabs. So these are 3 swabs. And you start at your insertion site and work your way out. I also make sure that I'm cleaning the actual catheter, and then I'll go down below and clean the clamps and things, just because a lot of times they won't get cleaned otherwise. This is great, especially if the patient's got dried blood or anything like that that's been causing any itching, anything that's caused any discomfort, and it'll just feel better on the patient to have all of that removed to begin with. So now we're going to let the alcohol dry completely. You want to let the alcohol dry between alcohol scrub and your chlorhexidine scrub. So the next step after this would have dried completely is to use the chlorhexidine. This is just a click release. So we're going to click it and we're going to start at the insertion site. We would not start outside and go back in. We'll also grab a piece of sterile gauze so that we can hold our line and lift it up to clean underneath. So starting here and then working our way with that great scrubbing action that we talked about. The scrubbing action is going to help prevent staph epidermidis, which is some of the normal bacteria that's found on the skin, but if it gets into the bloodstream, it can cause eclampsia. So I would scrub with this for a full 30 seconds. And then we let it dry completely. Dry time is usually 1.5 minutes to 2 minutes. If you rush through and try and apply your securement device and new Tegaderm too early, you're going to have to restart the entire process. So in this case, patience is your friend. Another thing you can be doing is making sure that you're looking at your site. If you're noticing any redness, swelling, that's definitely something that you would want to document and approach appropriately. There are 2 types of securement devices that you mainly see. This one is a grip lock. It's just Velcro and sticky. The other kind is a stat lock, which is going to have the plastic wings that clip. The plastic wings that clip are great for a PICC line, but they will not work for a midline because they do not always have wings. So once this has dried completely, we're going to apply our grip lock. So remove here and pull away. Now, this is when you would either use a bio patch or you would use your CHG Tegaderm. I'm going to just show a CHG Tegaderm, and in another video it'll show a bio patch. The CHG Tegaderm has a window, and that window needs to be centered over your insertion site. All edges need to adhere appropriately. This piece goes underneath. And then this portion has a spot for your initials, time, and date. I usually write that there, and then I write on the actual dressing itself, just because with CHG baths, patients moving, things like that, sometimes that extra piece has been known to come off, so it's good to write on the actual dressing as well. After this, I would change my end caps, and we'll discuss that in another video.